Tony, this month, the American Society of Plastic Surgeons launched a renewed campaign to make people aware that they should use only qualified, certified doctors to perform plastic surgery. Some doctors who are performing cosmetic procedures don't have adequate training, and this can lead to pain and discomfort, disfiguring, and even, in some cases, death. Joining us this morning, Dr. Joseph Michaels, a board-certified plastic surgeon and director of Monarch Aesthetic and Reconstructive Plastic Surgery in Bethesda, Maryland. Dr. Michaels, welcome to the show.
Thanks so much for having me.
Why the need for this sort of campaign, this push for awareness?
I think it's really just to make the public aware, not only that they should be doing their homework on the procedure that they're looking to have, but also on the surgeon that is doing that procedure on them. In the United States, if you're licensed to practice in a certain state, have a medical license, you can practice really any field of medicine and or surgery, and a lot of the public is not aware of that. So then you would need to check for certification specifically then in cosmetic surgery? Correct.
Okay.
Well, cosmetic
plastic surgery.
Correct. So one thing that this campaign is trying to allow the public to know is that cosmetic surgeons don't necessarily equal plastic surgeons.
Okay.
And when you're looking for a plastic surgeon or a cosmetic surgeon, it's very important to make sure that these doctors are certified by the American Board of Plastic Surgery and that they're members of the American Society of Plastic Surgeons, because that ensures that doctor has the highest level of background training, performs continuing medical education, and also adheres to a very high ethical standards.
Would cosmetic surgery then be more minor things, say like Botox injections, that kind of thing? What is the difference? What do we need to look for?
I think with any procedure, again, you just need to make sure that doctor does that procedure often, has the training to choose patients that are good candidates for that procedure, as well as treat any complications. And that could be a minor procedure from even a mole removal or Botox to more invasive procedures like body contouring or facial plastic surgery.
Can you tell us or go through some of the steps that one should follow if they're considering some sort of a treatment? What steps do we need to follow to be safe?
Again, I think doing your homework for the patient is really first and foremost. You want to make sure that doctor performs that surgery often. You want to ask your doctor, are you board certified? Are you a board certified plastic surgeon? What's your background? Do you have any specialty training or fellowship training? You also want to ask about the risks and complications of that procedure, and the doctor should be very upfront with you regarding those issues. And another thing you want to find out is, do they have hospital privileges to perform these procedures? Because one of the issues is that a lot of these procedures are being performed in med spas and in the back of doctors' offices, and if the hospital wouldn't give a doctor privileges to perform it, why would you want to go see that doctor and have it done in their office?
That's one huge red flag. Can you go through some other red flags we should keep in our minds?
Great question. So some red flags you want to look for are, doctors not being upfront about their board certification. They say they're board certified, but it's not very clear in what field of medicine they're board certified. Do they have hospital privileges? Because again, hospitals independently credential doctors for those privileges based on their training. And so if they can't get privileges in a hospital to get those procedures done, why would you want to go to them? You want to see adequate pre- and post-op pictures to make sure that you feel comfortable that they can perform that procedure for you. Doctors that advertise prices that are well below market should also be a red flag, because that might be the reason why they're attracting patients for the financial reasons, not because of their training. And you can also look up on your state medical boards to make sure that there's no reprimands or any other issues with that particular doctor.
Great advice. This, again, is the month that you're calling awareness to all of this, because a lot of us are going under the knife or doing more simple routines. I don't know if it's in this, reality show world that we're trying to look like stars or what have you, but good advice if you are looking to do any such procedure. This is Dr. Joseph Michaels with Monarch Aesthetic and Reconstructive Plastic Surgery in Bethesda, Maryland. Thanks again.
Thanks for having me.
Tony, over to you.